Welcome. I hope everyone had a good break and is glad to be inside out of the rain. There's nothing competing. So I'll just begin by introducing myself. And I'm fairly informal. This feels very formal, but I'm fairly informal. So I might ask you questions as we go along. If you have a question, I've just been told because it's live streamed, I'm just going to have to repeat it. So just sort of be aware of that. It's not that I'm not repeating because to do anything, but just to make sure that the people who are online, the live stream here. So my name is Andrea Silverstone. I'll talk a little bit about who I am and where I'm from in a second. And I'm going to be talking today about domestic abuse, coercive control, and COVID. Just before I begin, I want to do a bit of a land acknowledgement. This is something that for me feels very important. I'm going to talk both about a land acknowledgement of where I come from and also where I am right now. So I come from Calgary, Alberta. We are in the land of the Blackfeet and the Dene, and we have treaties in where I come from that were signed with those nations. I honor those treaties, and I recognize that we are all treaty people in Canada. And that means that we honor the Aboriginal and Indigenous ways of knowing. And so I want to bring that in. And then the second land acknowledgement that I'd like to do is to recognize that I am on the land of many different nations who met here, who I actually was at the Fraser Museum yesterday and read that they were essentially decimated and that they no longer identified as Indigenous or Aboriginal because of the decimation that happened in the early 1800s. But I do recognize that that did happen to their nation. And I think that that's just an important acknowledgement. And I appreciate that the Fraser Museum, I encourage you to go and see it, talks about that history. So who am I? I am the CEO of SAGES. SAGES is an organization that empowers people, organizations, and communities to break the cycle of domestic abuse. We do that through a bunch of different ways, but primarily we have both a intervention stream of work, and that intervention stream of work is individual clinical supports for those who have been impacted by domestic abuse and sexual exploitation. We also have intervention work. We also have prevention work. Our prevention work is focused on changing the structures of abuse through primary prevention. So that is about policy, legislation, as well as making sure that informal supporters know how to be good peer supporters and disrupt the structures of abuse. And then we also do it through innovation. And I'll talk a little bit about the role that in particular played around our response to COVID. So I'm from the province of Alberta in Canada. There's about 4.6 million people where I live. Our organization is a provincial organization. So in theory, we're supposed to be serving all of those 4.6 million people. What that actually means is that we operate in about 65 jurisdictions across the province of Alberta. The largest city, which is where our head office is located, is Calgary. There's about 1.5 million people. About 16% of our population is rural and the rest are urban. We have a lot of economic boom and bust because we are reliant on natural resources, primarily oil. And so we have a very high employment rate for Canada. As you know, that there has been 4 waves of COVID so far. I'm hoping that's it, but in theory, that's how many waves we've had in Canada. We've had about 248,000 cases of COVID in Alberta. And as a result, I think a lot of people have heard this, but domestic abuse has been called the shadow pandemic. You can actually chart the rates of domestic abuse according to how also the rates of COVID happened. Rates of domestic abuse have gone up since the beginning of COVID by 30%, and they have never gone down again. So I want to talk a little bit about how we understand domestic abuse, because I think that that's really important before I even talk about the response that we had as a result of COVID, because I think that it's really important to be able to frame something before you can address something. And so I'm just wondering how many people are familiar with the theories and concepts of coercive control, just by a show of hands. Okay, so most of you. So I'm not going to go too far into this, but I thought it was really important to ground. So traditionally, domestic abuse has been based on the violent incident model. It's been based on this idea of broken bones and black eyes, and that there's a one-off incident, and that incident is a chargeable or a criminal offense, and then everything else falls after that. And so because we've used the violent incident model in domestic abuse for so long, that means we focused on physical assaults and episodic incidents. Our response has always been about harm and safety planning, but safety planning from a perspective of physical safety, right? So let's get the person to leave the abusive situation. That will make them safer. And there's always been a focus on the victim. And generally speaking, the victim has always been seen as a woman. I think it's really important to note that there's some research that's been done by a sociologist named Michael Johnston, who talks about the fact that there is a difference between domestic abuse and intimate partner and intimate terrorism. And intimate terrorism is what we traditionally think of when we think of domestic abuse, because all of our services are built around intimate terrorism. And mostly so, women are the victims of intimate terrorism, about 92%, according to his research. Domestic abuse, which is mutual, often sometimes mutual couples conflict, is the majority of cases of domestic abuse. And actually, it's much more symmetrical than intimate terrorism. I very much encourage you, if you're interested, to look into his research. So why does Michael Johnston. It's the topologies of domestic abuse. Now, why is that not a good model, the violent incident model? Because it actually doesn't talk to the real experiences of domestic abuse, and it for sure doesn't talk to the mutual couples conflict, which is actually most of what happens, which means that those people never get supports and services, and they never reach out. And we also know that during COVID, those were most of the people that were actually suffering and had escalation of violence. Because it's much easier to know that you need to leave when your life is in danger. It's much harder to know what to do when it doesn't feel that severe. Although it is severe, and there is still a high risk of homicide. And actually the death reviews that have happened in Alberta have shown that mostly so, those people were not even on the radar of the system, because it was coercive control, not the violent incident model for those people. So the approach of coercive control is much more descriptive of the impact on the individual, and it's expansive, right? So it talks about are you afraid of your partner? This we call it the fear factor, right? And so that actually is what's most important, is the fear factor more than anything else. It's also much more expansive. It understands that domestic abuse is much more than a broken bone and a black eye. It also addresses the harms to personhood. It understands that this is an issue of the removal of personal agency, not an issue of physical safety. Physical safety is a characteristic, but it is not the entirety of the picture. And also it's on a focus on everybody, the perpetrator, the victim, the bystander. It understands that domestic abuse is not the victim's issue. It's actually a societal issue. So as a result, when we think about domestic abuse at SAGES, we think about it fully and completely within a coercive control context. So we understand coercive control as being a pattern of behavior to regulate and dominate the intimate partner's life. And it undermines the sense of self and isolates from support, and it removes personal agency. I just want to note, and I just have to say this as an aside, I happen to also be doing my PhD in applied psychology with a focus on coercive control in comparative contexts, because everything I'm going to say to you right now can be said about cults. It can be said about gangs. It can be said about political movements or social movements that are coercively controlling. So we just happen to be talking about it in terms of domestic abuse, but I believe that it can be universally applied. That's my theory, at least from my PhD. I'll let you know in a few years if it ends up being true. So one of the things that we talk about when we talk about coercive control is that creates invisible chains and a sense of fear that permeates all decisions in a person's life. I think it's really important to talk about it in terms of human rights, because it limits human rights by depriving an individual of their personal liberty. And the reason I think it's so important is because there's lots of legal implications if we understand it as a human rights issue. Feels like this ever-changing rule book with rules that you never know what they're going to be. So when we talk about coercive control at SAGES, we very much look at Biederman's chart of coercion, which is why I do believe that there's a universality, because this chart of coercion has not only been used in domestic violence. Biederman actually didn't even create it in the 50s for that reason. He created it as a result of understanding the experiences of prisoner of war and the brainwashing that happened to them. And so I'm not going to go into too much detail, but I very much encourage you to look at his work. But these are the ways or the mechanisms that are used to create a coercively controlling environment. So one of the things that I think is really important to note about coercive control is that it's often low level and not injurious in the traditional sense. Right? So there's not usually broken bones or black eyes. In fact, there's usually not even a threat of violence, physical violence. It's cumulative in its impact. So this is really important. It's a pattern of behavior, and it's frequent and not episodic. And so much about that violent incident model is it's an episodic model. And so one of the reasons that we adopted coercive control as our framework is because so many clients were coming into our agency and we're calling, I don't know how many people are familiar with Prochaska and DiClemente's, their, oh my gosh, I'm totally having a moment, but their theory of change. But one of the things that we noticed is that a lot of people were in this pre-contemplative stage. They would call and say, I think I'm in an abusive situation, but I've never been hurt or I've never been hit. And once we described it to them as this way, they're like, oh my gosh, this is totally me. Pardon? Prochaska and DiClemente. They are two psychologists who created a essentially theory of change. There's 5 stages in their theory of change. So the other thing is that coercive control moves through spaces in ways that if we are aware of it, we will identify. And so what I mean by that is that an example might be someone has a partner who shows up every day to have lunch with them. Now, in a coercively controlling situation, the person who is the victim doesn't want their abusive partner showing up every day for lunch, and that feels like being controlled and being checked on. And you'll notice that because the person tenses up, they get upset, they're worried about not having lunch with their partner. But exactly the same event could happen in a healthy relationship because you want the partner to show up every day for lunch. And so coercive control is so much a matter of perception. And it's also a matter of, and so it moves through these, our public spaces or our joint spaces or our community spaces, but we need to be able to identify what is going on. So I just want to talk a little bit about the underlying theories. There's a few underlying theories of coercive control. One of them is a gender inequality theory, mostly put forward by Stark. And so his theory is that men protect and extend privilege, which then contributes to gender inequality, that then men exploit that inequality, and then there's an established domination or subordination as a result of it. I got to say, I'm not a big fan of this theory. I think it might be too narrow. I think it does apply in some cases of intimate terrorism in relation to domestic abuse, but I think it's too narrow as a general theory. But I think it's important to note it because I think it is one of the founding theories that led us into coercive control. Then there's Hassan's theory, and it's about authoritarian control. He has the BITE model, which is about behavioral control, informational control, thought control, and emotional control. And then there is the theory that I most like, which is the totalistic identity theory, which is the domination of a person's self-identity by a person to the exclusion of other aspects of identity, with potential effects on mental health. So how do I understand all those words? Because there are a lot of words. For those of you that know Rod Dumbro Marshall or Linda, that is a very broad and broad specifically definition. But what it really means, at least as I understand it, is it's a colonization of personality, where one individual colonizes another individual's personality. I also need to just say that Rod and Linda are my PhD supervisors, so I'm a little biased. So we think, like I said this, I think coercive control actually happens in many contexts. I'm just talking about domestic abuse today, but I think you can apply what I'm saying today to all of these contexts. The other thing I just want to note is that coercive control is more predictive of homicide than physical violence. So I think that this is a really important thing to note, because I think that so often we think that physical violence is the thing, and it's actually not. It's coercive control. And these are some of the ways that you can measure coercive control. This comes from the DASH, which is a risk assessment that's used in the United Kingdom. I am, by the way, happy to share these slides. I think I can do something in Wahova afterwards to share the slides. I'll try and figure out the way to. If not, my email is at the very end, and please feel free to email me. Okay, so why am I here today to talk about specifically the natural disasters? So natural disasters make domestic abuse worse. We know that when there are floods, fire, economic disasters, whatever it is, it makes it worse. And the violence persists, or the abuse persists long after the natural disaster ends. It usually, the natural disaster usually has an arc, it hits a peak, it goes down, but the rates of domestic abuse never follow that peak. They go up and they stay up. So some of the compounding risk factors are a feeling of helplessness, right? Because that's what happens when we experience a natural disaster, a feeling of a loss of control. There are always mental health issues that are related to natural disasters. There's financial strains and there's health strains. So all of those things exacerbate already existing issues that might be present in a relationship that are causing or contributing to the domestic abuse. I want you to note that nowhere here am I talking about alcohol and drugs as being a contributing factor, because they're not. They're coping mechanisms, and they're sometimes aggravating factors, but not contributing factors. So the populations that are most at risk during a natural disaster of domestic abuse are children, women, 2S LGBTQ+ communities, the elderly, the disabled, and households that experience significant financial strain or already have pre-existing health or mental health issues. I will also say that our context in Canada is very different than yours in the United States, because we have a very robust social support system that my understanding is that you don't have to the same degree in the United States. So although we have definitely aggravating factors around like mental health and health issues and financial strain, I don't think that they're as severe as what you have here in the US. So it's really difficult to quantify the impact of natural disasters because domestic abuse is generally underreported. We know that only about 20% of domestic abuse gets reported to the police. We know that only about 35% of people actually access services. So that means the other 65% of people are suffering on their own in silence and underreported ways. That's why informal supporters are so important. Data collection is really challenging. And of course, natural disasters, they're chaotic. It's hard to get reporting during a natural disaster. I just want to say that there are examples that have been researched that very much talk to and show that there is an increase of domestic abuse as a result of natural disasters. The Canterbury earthquake, there was an increase in domestic violence calls. All of the fires in Australia, Hurricane Katrina, Hurricane Andrew. And now, of course, we're starting to actually have real data from COVID, because we're now a few years in, that very much is saying that the rates have gone up about 30%. So this is some of the early data that's come in. There's more data all the time that's coming in. For us, I just think that it's important to note, sorry, how do I go back? I just want to say that for us, the number of people accessing our services increased by 82%. Right, so we're one of the biggest organizations in Alberta, probably with some of the most far-reaching, most far-reaching, and our numbers went up by 82%. So also part of the reason we had such a spike is because we had thankfully an organization that was very able to turn on ahead of a dime, as other organizations had to actually shut down. And so we also got a lot of those clients coming through, so that 82% is a little bit of a false number, because we also know that it was other clients from other services that had to shut down. So the risk of lockdown. Not everyone is safer at home. I think that we all know this. I don't think I have to tell any of you this, right? There's a loss of connection. Domestic violence typically wait until the perpetrator leaves home in order to access supports. Nobody was leaving home, and victims were isolated with their perpetrators. So what did we do? We talk about moving fast in our organization, but moving fast to create an environment of learners instead of the learned. We have a tendency, at least I'm going to talk about, I'm a social worker, I'm also a psychologist. I know that my professions, we have a tendency to be very backward looking. What does the research say? Let's wait till it's published. Let's be very purposeful about it. We are very much about being the learned because we're very worried about doing the right thing for our clients and not being haphazard with their lives. But having said that, COVID, I think, taught us that we have to be learners. We have to innovate in a way that we never had to innovate before. And so I think that part of our COVID response had to be about moving from being the learned to learners. I love this quote by Eric Hoffer, who's a philosopher. In times of change, learners inherit the earth while the learned find themselves beautifully equipped to deal with a world that no longer exists. So we did a bunch of things. We transitioned our programs online. Within 2 weeks of COVID starting, we were able to transition online. We'd never done virtual or online groups before, so it was a wild ride. There's lots of ethical implications to that. We have a lot of peer-based support. We had to engage volunteers and teach them how to do that online. We talked about safety planning in a very different way. And we had to create safe in-person options because we could not see our clients in person, especially some of like the sex workers that we work with who live on the streets or work on the streets, they did not have access to technology. Some of our rural and remote clients didn't have access to technology. We have an issue in rural and remote Alberta that there's terrible cell service access and internet access. The other thing that we did is part of our intervention and prevention work is we are a backbone or an umbrella organization for all of the other domestic violence and sexual violence organizations in Alberta. And so we pulled everybody together and had some collective impact. And so we did some training on how to address through COVID. We did a lot of campaigns that we did as organizations all together. That backbone role that we play is for about another 400 to 500 organizations. So making sure that everybody got the resources as quickly as possible. And then we also did something called the Mask 19 campaign, which was we trained, because everything shut down, but we trained pharmacists to be able to respond to domestic abuse. So if someone went into a pharmacy and asked for Mask 19, that meant that they were asking for domestic abuse services. So that's sort of like what we did. In a nutshell. I don't have very much time. There's about 5 minutes left, I think. And so I would maybe like to give an opportunity if anyone had any questions, or if there was something that you were thinking I was going to cover today, or that's why you came, but you didn't get it answered, because we wrote a very, very long abstract and then realized we only had a half an hour. So I had to shorten it as much as possible.